prostate cancer. It's the second leading cancer death in the United States and worldwide. In fact, some people say lung cancer is second after breast cancer in some populations, but in other worldwide, basically prostate cancer is the second most common cancer. And you see the incidence, you see the map here I put of various parts of the world where prostate cancer is common, in the darker blue areas. Well, do you see any relevance to the economic wealth of the people in these particular areas in the dark blue? Do you have any idea what these people eat? In Brazil and Argentina used to be the biggest consumer of beef in the world. They had the highest incidence of colon cancer in Brazil and Argentina in the world. Europe, Australia. Do you see the pattern? Rich foods give you prostate cancer. So in the US, there are 288,000 new cases and 34,700 deaths. That's a lot of difference. That's like 1 in 10 people die who get it, right? In other words, 9 out of 10 could have been spared even finding out that they had it. I think so. All right, so this is the mistake that I would guess most of our listeners are making. And the reason is that people believe the following. They believe a cancer starts as, a little area in particular one organ, breast, prostate, colon, etc. It starts as a single cell, and then it grows in that particular tissue. And it keeps growing and growing and growing, and finally gets really big. Well, maybe not that big, but maybe that would be big enough. And when it gets bigger, then it metastasizes. And it doesn't metastasize throughout the body first. It goes to the lymph nodes first. And then past the lymph nodes, it goes to the rest of the body. And this is why, most surgeries are attached with an extra surgery, which is to remove the lymph nodes. Is because doctors, not a scientist, not a people who understand what's going on, they understand there's a centripetal event that goes on where they believe it's in stages: little cancer, big cancer, spread to lymph nodes, and spread to the rest of the body. So we have this test called a PSA, prostatic specific antigen. It means it's a protein that is derived from the prostate gland that gets elevated when the prostate gland gets inflamed, irritated, or when it develops prostate cancer. Now, as men...
That's a blood test?
Blood test, yeah, little blood test.
Okay.
So you have all these screening programs. Doctors are out there telling you, you're a bad person if you don't get your PSA tested. Everybody's got to get their PSA. But not so much lately, because the medical profession has come to realize what the truth is of this testing and treatment, which you're going to learn about today. If you randomly select men off the street and you get a blood test on them, 10% will be positive for PSA. So you got a 1 in 10 chance. If you allow somebody to have your blood, a 1 in 10 chance of having an elevated PSA. And then you're told to have a biopsy. It's not a biopsy, it's 12 needles that are stuck through your rectum into your prostate gland. And in the process, they injure the nerves of the prostate. We'll talk about that in a minute. Okay, so 10% of men are going to be found randomly picked off the street. Of those who have a positive PSA, about 30%, depending on their age, are going to be found to have prostate cancer. Whoa! Depending on the age, 8% of men in their 20s have a positive PSA or positive biopsies for prostate cancer. 30% of men in their 30s have a positive biopsy. 50% of men in their 50s. And men my age, it's almost 100% have prostate cancer on biopsy. But that's on biopsy. You can have cell changes occur in the prostate without it going on to metastasize. And that's what happens in most cases. Or it's so late in its metastasis process, it's spread, that you die of something else first. And one other thing you got to know about this PSA testing. I told you they stick 12 needles in your prostate through your rectum. But the needle biopsy is 12 needles stick in your prostate gland. Yeah. This damages the prostate gland through which the nerves that control your erectile dysfunction pass. Erectile function pass. The nerves that control your erectile function. That's your penis. They get injured. 41% of men report erectile dysfunction 1 month after surgery. And for 15%, it becomes permanent just from the biopsy.
Really?
Yeah. And about half of men experience pain during the biopsy. It's not fun. I've never had one, but I hear it's not fun. What I recommend is, first of all, men do not get a PSA test. You have a 10% chance of being a cancer victim. And then don't go on and get a biopsy. You have, depending on your age, you're my age, you have 90 to 100% of you being told you have cancer. Don't do it. Then when it comes to the next phase of treatment, don't subject yourself to radical treatments that leave you impotent and scarred and bowel obstructions and all kinds of garbage. Don't do it. There's no survival benefit. Will your doctor tell you yes? Yes, he or she will, because it's so well known what I just told you that none of them would dare look you in the eye and tell you otherwise.
Really?
Oh, yeah. All right. So what are the else should you do, regardless of whether your PSA is positive or negative, or whether you're diagnosed as having prostate cancer or not? The American Cancer Society came out on February 13th of 2015 and said that after you're diagnosed with cancer, breast, colon, prostate, melanoma, you need to change your diet. You see what they say? Prudent diets based on fruits and vegetables and unrefined grains. Do you see that there? And not to eat the Western diet with the meat, processed foods, and the fats. Do you see that? That's our American Cancer Society. How many doctors recommend to their patients after being diagnosed with having breast, colon, or prostate cancer that they ought to stop throwing gasoline on a fire? Makes no sense. Anyway, so fat is the dominant factor. If you had to say one thing, you'd say fat is what not only initiates, but also promotes the development of these cancers. They grow faster on a high-fat diet, you die sooner, et cetera. And that's why the American Cancer Society tells you to eat a low-fat diet. But, it's not just the meat. It's just not the processed meats that they keep talking about. They tell you that the prostate cancer, breast cancer, colon cancer are caused by red meat, and especially processed meat. You go, oh, I only eat chicken and turkey and ham. Well, excuse me, that's red meat. And it doesn't matter whether it's processed or not. That's meat. A muscle is a muscle is a muscle. Maybe not be as red as you like, but once upon a time it was bloody red. Anyway, so that's what you do.